despite what the article said out of China early on, we're seeing 40 and 50-year-olds needing oxygen, having worsening lung involvement, and then those patients are the ones sometimes being put on ventilators, which is not kind of consistent with the original information.
That's Dr. Joel Fishbain, an infectious disease specialist with Beaumont Hospital in Grosse Pointe, who you'll hear more from later. And this is your Daily Detroit for Tuesday, March 24th, 2020. I'm Jer Stays, coming at you from our home studio in Detroit's North End.
And I'm Sven Gustafson, broadcasting from my newly enhanced basement office setup in Ferndale. We're practicing safe, social distancing podcasting because things are getting very serious with the coronavirus, friends. Both of us know people who have been seriously sickened and even killed by COVID-19.
I learned about someone just before we started recording, Sven.
Yeah, I know. This stuff is getting heavy for sure. If you haven't already done so, friends, it's time to take this very seriously. If we're going to minimize the spread of this dangerous virus, not prevent it, just minimize it, then we have to take it deadly seriously. Take the governor's stay-at-home order seriously. She didn't issue it lightly. It has major impact, but it's important. There's nothing more important than our health and safety at this point. Stay away from groups of people. Wipe down your computer, your mobile phone, your TV remote, anything that you handle often with sanitizing wipes. I did that first thing this morning. And please pay attention to good sources of information.
Right, Sven, like the CDC, the state of Michigan's coronavirus website, hospital systems, or the World Health Organization. And of course, we are firmly committed to helping shut coronavirus down so we can all get back to our friends, our family, and our work, and hopefully something approaching normal.
The Detroit Police Department has seen its first COVID-19 death. A 38-year-old call taker with no preconditions died Monday. His name was being held until his family is notified. The victim had apparently traveled out of state on vacation and came back with the virus. He passed away in a suburban hospital. Detroit Mayor Mike Duggan says that due to the shortage of testing capacity, there was a 4 to 5 day delay in getting the results, which the city received only after his death. 282 Detroit Police Department employees are now in quarantine as of this recording, with 9 confirmed coronavirus cases. This call taker victim worked in the Emergency Communications Operations Center. So the department moved to their backup center so the main facility could get a deep cleaning.
There are new social distancing and screening rules in effect for businesses in Oakland County, per a new order by County Executive David Coulter. The rules impact the small number of businesses that are deemed essential and still have employees working on site, as well as places like grocery stores. The order takes effect Wednesday at noon. It requires businesses to have a daily screening program for all staff, including questions about possible symptoms such as fever, cough, or shortness of breath, and if employees have traveled domestically or internationally in the past 14 days. The employee could be required to stay home for up to 14 days, depending on the answer. Businesses also need to manage and control social and physical distancing with at least 6-foot spacing for employees and customers waiting in lines within or outside. Businesses need to use visual markings, limit building capacity, and post the new protocol at the business entrance.
All of this as the state of Michigan on Tuesday increased the overall number of confirmed COVID-19 cases in Michigan to 1,791. That's a jump of 35% from Monday's numbers alone. The number of deaths was up to 24 compared to 15 a day ago. We've also learned that Henry Ford Health System on Tuesday reported having 170 inpatients across its 5 hospitals who have tested positive for COVID-19. That number is almost double what it was just a day ago when it had 86. And we tip our hats on that one to Mark Cavett of the Oakland Press, who posted about that on Twitter.
Our guest today is on the front lines of fighting against the coronavirus. Dr. Joel Fishbain is an infectious disease specialist at Beaumont Hospital in Grosse Pointe. He spoke with Sven earlier today.
The most recent numbers posted on Beaumont's website suggest that as of yesterday, there were 333 patients who had tested positive for COVID-19 and are currently admitted in a Beaumont hospital. Nearly the same number of positive coronavirus cases were apparently healthy enough to be sent home. Dr. Fishbain, Beaumont's CEO John Fox had published an extraordinary blog post last week on Friday in which he said, in part, that you guys have converted much of the entire health system over to coronavirus screening, testing, and treatment. Give us a sense of what's happening inside Beaumont hospitals today with this new reality.
Oh, nothing's going on. No, I'm just kidding. Okay. So obviously we've had to set up isolation wards where we put all of the patients who are COVID or COVID suspected infected. We've had to use tremendous amounts of resources for masks, gowns, gloves, etc. Our ICUs are full of COVID patients, so we've had to expand our ICU capacity as if other institutions that have, smaller intensive care units. So elective procedures, as you know, have been curtailed at this point to make way for the resources that are necessary. So a lot of changes have gone on by senior leadership to make sure that we have the ability to provide care for these patients if needed.
Mm-hmm. So with 333 patients admitted, I'm sure that number probably will go up when the numbers are updated for today. How is that comparing with your capacity to care for these COVID-19 patients?
Well, I only work at Grosse Pointe, so we have roughly around 200-bed hospital, and we are able to keep all of these patients at least currently on one floor and still have some ability to care for other patients on the other floors and keep them separate. The intensive care units has become obviously more of a challenge as these patients get sicker and they end up needing ventilator support. That actually becomes a greater challenge for space and capacity than really just regular patients.
Yeah. We keep hearing about shortages in supplies, personal protective equipment, surgical masks, and especially ventilators. What's the situation, on the ground at Beaumont and Grosse Pointe?
So I actually don't participate too much on the calls each morning for the critical care team, but I know we have ventilators available up to a point. I can't give you a number. I don't know those numbers. We do have some space for a few more patients who would need to be intubated, and put on ventilators. So for right now, we would not say that we were closed to any additional ventilated patients. As far as the other resources and equipment, we're kind of holding our own. Obviously, the N95 mask-related issue is a countrywide issue, not a local issue. Mm-hmm. Everybody is struggling, I think, to maintain sufficient supplies of the N95 masks, which is why they're, asking people not to buy them or turn them in if they have them. And we're just waiting, I guess, for the production line and the supply system to be able to catch up to the demand. But that is the biggest challenge, is making sure that all facilities have sufficient N95 masks for protection of the healthcare providers.
What about testing kits? We've heard an awful lot about the shortage in tests for people who think they may have the coronavirus.
We are doing in-house testing through a company, and I have not been on any of the conference calls lately to hear about any shortages currently or if we were going to have problems with continuing testing. That's a good question. Last week, there was the potential of maybe a few weeks of available reagents, et cetera, but I'm hoping that they have solved that problem, because next week would be the potential crunch time for maintaining sufficient reagents and test kits to be able to continue the kind of volume testing that we're doing. It is really wonderful. We're getting our test turnaround times in less than 24 hours. So, we're very happy with our laboratory and all the work that they have put in to get us up and running. They are to be really commended and applauded for their efforts. And it has been a tremendous help to us so that we can immediately get these people identified and treated if needed.
So far you're keeping up with the demand for testing? Is that what you're saying?
So far, we're good with the demand for testing.
Okay. We know the main symptoms of coronavirus: fever, cough, shortness of breath. Are doctors learning anything new or unexpected about coronavirus from the patients that you're seeing so far? I mean, for example, we've been hearing one of the newest things is we talked about it on our show yesterday. Some people are reporting a loss of ability to smell or to taste foods or beverage. And I've also heard that some people, their fever and their symptoms seem to go away for a while, but then they come back in sort of greater force. Are you seeing those kinds of things or anything else?
Right. So all I can tell you is based on experience, none of this should be considered scientific evidence or cumulative data with some peer review evaluation. So this is just sort of our experience here. We're seeing patients with mild symptoms, like people are reporting who have been able to go home with no treatment and recovered. We're seeing people who are getting more short of breath and requiring oxygen. But what is different, I would say, is despite what the article said out of China early on, we're seeing 40 and 50-year-olds needing oxygen, having worsening lung involvement. And then those patients are the ones sometimes being put on ventilators, which is not kind of consistent with the original information. But I do have a feeling, and we're going to hear more and more from other places like Seattle and New York, that their experience is the same. As far as other symptoms, we were a little surprised recently about this robust diarrhea that patients are getting. They report really profound diarrhea, multiple liquid bowel movements on a daily basis. And that was not really expected, but clearly is consistent. The terrible, terrible muscle and joint pains, people just horribly in pain, even to the point that they can't breathe because their chest hurts from the pain. So that's a little bit interesting to see in some of our patients. And then the other thing is, so many say that food just tastes horrible. The smell is awful. They don't want to eat anything. It has a very bad taste, and they're not eating and drinking very much. Nothing is appealing. So yes, that is correct. They're probably losing sense of smell because, as you know, taste and smell do go together anyway. And they are really reporting just horrible appetites, and food just makes them sick.
Many people are still sort of dismissing COVID-19 as, just another form of the flu. What do you say to that?
I was in their ballpark, to be honest, early on, but now I'm a believer that this is more than just the flu. And it's more than just the flu because of what appears to be the sheer infectivity. I know that the experts in epidemiology are still trying to calculate what the number of infections occur per exposure, what they call the R0 value. And everybody, I'm sure you're aware of, reports measles as being 14 to 15, which means for every case of measles, you get 14 to 15 additional cases. The number that this disease is going to come out to be is still unknown, but it is truly amazing how people can be congregated at a birthday party or a celebration, and so many are coming in sick over the same period of time. So it is clearly a very infectious process and disease. And we're also dismayed at the number of young people, and I say young, in their 40s and 50s, who end up with bad respiratory failure on the ventilators, and they don't come off quickly. So they're staying on the ventilators for a long period of time, which means you can't move them out of the intensive care unit quickly. So these are all things that I don't believe that anybody really predicted or saw coming. Now we're all believers.
What kinds of steps are your clinical staff taking to, try to safeguard against transmitting coronavirus both to one another and to other patients in the hospital?
Right. So, the standard infection control practices, obviously include hand washing, and that would include the alcohol-based hand hygiene products. So those are important. We're using masks, gowns, and gloves, and we're not using them between patients. And so that helps to prevent carriage on our clothing. We're making sure that our healthcare workers are not at all sick. If they do think they're sick, they are to stay home. And if they had an exposure, we have a process by which they monitor very closely their symptoms. They can work after exposure, but they're supposed to monitor their symptoms extremely closely. So we're all keeping our distance. We're all doing what we need to do. And so far, knock on wood, we're doing pretty well, as I think most hospitals probably are.
Lastly, Dr. Fishbain, we've seen reports of people taking some kind of unconventional anti-malarial medications that have gained currency as a possible cure for coronavirus. Is that a good idea?
So if you're asking me, should the average individual contact their providers to get a prescription for hydroxychloroquine and azithromycin to take at the first sign of fever, I would say absolutely not. And there's a couple reasons. And so the long answer would be that, first of all, the data clinically driving this treatment train is really kind of limited, but we're going to get more information after this is all over. The culture data in the test tube would suggest that hydroxychloroquine and chloroquine work well, and the addition of the azithromycin probably, I'm guessing, has an anti-inflammatory effect. But it is very clear that there is a lot of inflammation in the lungs from this virus, and the question is whether those two drugs really do impact the viral replication and shorten the disease and limit the complications, or is it anti-inflammatory? And again, the dust has not settled at this point. But we have to caution people. These two drugs have an impact on the heart conduction system, and there are people who are maybe putting themselves at risk for a complication, which could include death. And so we would not advise people to take this combination of pills without the doctor being very careful with the prescription and advising, as well as understanding the patient and potential risks. But until somebody tells me, these drugs work beautifully and everybody should take it, we're trying to be very judicious with the use. We are giving it to people who look like they're going to get worse and have high levels of risk factors for getting worse, but everybody is definitely not getting this combination of drugs because of this heart-related issue.
Are there any, over-the-counter drugs or anything like that that have proved effective in at least, managing symptoms or anything like that?
Proven, no. I think a lot of us in our years of experience, we talk about simple things, good nutrition. People talk about zinc with shortening the course of the common cold. Melatonin has been thrown out there as an anti-inflammatory and as an explanation of why very young children don't seem to get super sick from this, is because of the melatonin levels in children. So there's a lot of rumblings out there about over-the-counter. We would recommend, obviously, acetaminophen or Tylenol. It looks like the WHO, the World Health Organization, has removed that cautionary note about the non-steroidal agents like ibuprofen. And I think patients can, get the sense themselves which one they want to use. They can ask their doctor if there's any updated information. But, keeping the fever down, keeping the aches down, getting up, walking around the house, making sure they're coughing, deep breathing, and if they get short of breath, come for evaluation. But it's going to probably prove that most people could stay home and take these drugs for symptomatic treatment. But as far as one preference over the other, we just don't know.
All right. Well, great information. Dr. Joel Fishbain is infectious disease specialist at Beaumont Grosse Pointe. Dr. Fishbain, thanks so much for sharing all your knowledge with us. We appreciate it.
Thank you for the invitation and good luck.
As I mentioned, Jer, Beaumont's CEO, John Fox, published a really extraordinary blog post on the health system's website as part of their ongoing coronavirus information campaign. The headline is Healthcare's Looming Financial Implosion. And let me just read the introductory paragraph. I just noticed this today. He writes, as American hospital systems have rapidly shifted their operations to screen, test, and treat patients infected with the COVID-19 virus, an immediate healthcare financial crisis is looming. It will be large and come on faster than people expected, and could cripple the core of America's hospital systems during this pandemic. Now, Fox goes on to explain that Beaumont stands to lose as much as $2 billion of its overall $5 billion in annual revenue because of the fact that it's shifting so many resources away from things like surgery, imaging, and other procedures that are high revenue items to lower revenue from admitting patients who test positive for COVID-19 and have really complicated medical needs. Fox says there's no way the health system can absorb that kind of loss on its narrow operating margin and cash reserves. So what he says is needed. He thinks the federal government needs to establish a hospital system superfund totaling between $300 billion and $600 billion to allow hospital systems to draw down payments to offset lost revenue. He argues the program, quote, will become crystal clear as we move into April and begin the real surge from the pandemic, end quote.
Those are some pretty scary words, Sven.
Yet another massive economic impact from this coronavirus. I mean, it's the scale of this thing in terms of its economic impact is almost too big to put your head around, frankly.
In related news, Beaumont has put out the call for donations of medical supplies, money, and equipment. They're coordinating all donations through the Beaumont Service Center in Southfield. We'll put a link to more information as well as to CEO John Fox's blog post in the show notes. Speaking of donations, the governor's office has made a direct request for donations of supplies. The items most needed in the state now are hospital gowns, ventilators, sanitizer, gloves, surgical masks, N95, N100 masks, and no-touch thermometers. Donations can be directed to the Michigan Community Service Commission by email at covid19donations@michigan.gov or by phone at 517-335-4295. That's 517-335-4295. Of course, I will put a link to all of this in the show notes.
Jer, meanwhile, there's some extraordinary news from Lansing. This would have probably been, up at the top of the show in any normal time, but of course these aren't normal times. Michigan Attorney General Dana Nessel has filed criminal corruption charges against Macomb County prosecutor Eric Smith and 3 others. A criminal complaint alleges that Smith set up and used 4 secretive bank accounts fed by county money for his personal benefit and for gifts to curry favor from others. The charges also target Benjamin Liston, a retired Macomb County assistant prosecutor and former chief of operations, Derek Miller, the county's current assistant prosecutor and chief of operations, and businessman William Weber, the owner of a security business. Smith faces 10 counts, including 5 counts of embezzlement and a single count of conducting a criminal enterprise. That's the most serious charge, and it carries a maximum 20-year prison sentence. The investigation stems from an external audit of Macomb County's financial records in 2016. It found irregularities with a mysterious bank account managed by the prosecutor's office that didn't appear on the county's ledger. The Michigan State Police later launched an investigation. It found that Smith had control over 4 separate accounts fed by money from seizures, drug and alcohol fines, and other funds, but were outside of county oversight. Macomb County Executive Mark Hackle eventually filed a complaint with the Attorney General's office.
The criminal complaint alleges that Smith continually refused to transfer the accounts to County Treasurer Lawrence Rocca. He eventually turned over 4 checks totaling around $230,000 and a note from Chemical Bank saying the accounts had been closed, but no account statements. Investigators estimate that around $600,000 was embezzled through these accounts. Smith has worked in the prosecutor's office since 1993 and was elected prosecutor in 2004. Nessel said it could be up to either Governor Gretchen Whitmer or the Macomb County Board of Commissioners to remove Smith from office. The latter panel happens to be chaired by Smith's brother, Bob Smith. All right, everyone, that was a lot of heavy stuff, the last bit on the show, but I want to close with something a little bit lighter. One of the challenges of social distancing, and we are so used to doing this show in person and together, all of our plans and workflows are set up so that we all do it here in the studio in the North End, but with practicing proper social distancing, we have to do this remotely, and we've had some hurdles, Sven, to say the least.
Yeah, indeed. Listeners did not like the quality of my audio from my basement here in my house. And they frankly let us know about it, didn't they, Jer?
Oh my gosh, they did. I was, you were audible, but the thing is we're just trying to make this work on a short timeline, working with what we got, we didn't really have time to put together more. Some of the responses are great. I'm going to read some of them.
Yeah, and before we get to that, let's point out that thanks to Cheyenne Nocerini, we are now set up and wired for sound, as a guy I used to work with like to say.
Yes, Cheyenne delivered it, and Mr. Engineer Randy procured it. So very excited. It's a team effort to make this happen and happen quickly.
Thanks to both of them.
But these comments, you listeners are fire, and we love you. First off, from Ben, if we all join on Patreon, will you promise to buy Sven a better mic and setup for his basement? Well, we've already done it, but Ben, please join us at patreon.com/dailydetroit. We made it happen. And that was the first, that was among an avalanche. Yeah. Continuing on. This next one is from Matthias, who wrote, "This was the day I remembered you're not actually a WDET show, though you should be. Sven sounded today like he's about to totally pwn some of his friends on Overwatch. It's Ferndale. That part of town has the highest number of weekend musicians per 1,000 people. Someone in a cover band has to have a spare mic. Love the show. Thank you for making it less scary in this time of trouble." You know, Sven, that's kind of funny that he mentioned video games.
Yeah, that reference like went over my head, quite frankly. But, you know, I do have a musician who lives right behind me. I could go knock on her door, and I could have, you know, asked her if she's got a spare microphone I could borrow. But we're all set now, though. So here's another one from Jamie, who writes, "This is Jer here at NPR Studios in Washington. And I'm Sven, reporting from my mom's laptop connected to a string and a tin can next to Sarah Palin's house in Alaska. Please, love you guys. Fix this. It's unlistenable." Ouch.
All right, and we are done for today on Your Daily Detroit. A final reminder that we are powered by our members on Patreon, and you can join them at patreon.com/dailydetroit. Y'all have really stepped up in big ways. I appreciate it, and it really matters. You know, advertising is just not a thing in this current situation, so every little bit helps, and we've got great rewards coming to you. They're in process, and I really just appreciate you so very much. As a reminder, we are doing this every single day of the week, 7 days a week through the COVID-19 crisis, keeping you connected, keeping you grounded to the stuff that is real, the actual facts, because that's an important thing right now.
Yep.
So with that, I'm Jer Stays.
And I'm Sven from my cat, Julius, whom we call the Podcat. He's really interested in my new setup down here. Take care of each other, everybody, and we'll see you when it's safe to do that.